So Andrew, Fraser, one was from here, another Wallabalua, and from Hollywood Mission at Yass. And then, Sydney base at the moment, but I'll be back in Canberra soon enough. They play a role which is a lot of roles, so they're not in a silo. They have an integral part of the holistic person-centered care and provide a conduit between the community and which is normally a big health system. Interpret a lot of information to provide in community terms and do a lot of role modelling for community and have a big responsibility to have a good communication system between the health and then back to the community as well. It's not limited, very diverse role and serves different purposes in different areas as well. So different areas have a higher list of responsibilities and different areas might have a little bit smaller. But no two are the same. So I don't think that, as I said before, there's not any 1 2 day the same. You also get the rewarding feeling because you're at the coalface with the patient-centered care, and so you get to see that change or improvement. What's more, generational rewarding. So you start to see the young ones being born in your service, and then you get to look after them and their whole family sort of care as well. So it's not like normal mainstream hospitals. You birth and then you go home and then you disappear. It's whole family working together. So that's quite rewarding, and also seeing their understanding of a big health problem come together. So they've got a particular diagnosis and you start to translate that for them and then they get understand and then you help them then manage that as well together with your medical team and such. So that's a really rewarding part, is seeing that they become educators within their own community as well. So always diabetes, they become diabetes somewhat educators to their community, helping identify symptoms and stuff like that. I experienced this, so then you should get that looked at. Go and see Dr. Fraser and things like that. So that's a really rewarding part. The advice would be just do it. That's for the future mob, and especially for the fellas, that it's female dominated because there's so many of them, but you don't notice that you're surrounded by females. You have a great opportunity to do great work, coming as a male, and then you've got shared responsibility, so you can delegate away from yourself. You don't have to do everything. Working with female co-workers as well, it's super rewarding, and it is what you make it. So it's not a super defined role that you have to do X, Y, Z. You can do the A, B's and C's, and there's flexibility in that. And if you have particular interests, like I do, I have a nutrition interest, so I do nutrition stuff. So you're not really limited, and you can go places, you can do great things. There's heaps of opportunity at the moment. You can grow in your organisation, and NAATSIHWP is a great organisation that provides advocacy and a bit of a role to provide training and professional development as well, so you're not stuck in your role at some community centre. You can move around, you can go different places and things like that. And those of you who are still doing it, keep doing it and seek opportunities to grow and learn and develop. You don't have to move around, you don't have to career jump and all that sort of stuff, but you can do better work in the same spot. So keep doing it and keep up the good fight. It's nice to be recognised. It is in and of itself, and as a bigger picture, it's important to elevate the profession. As I've sort of said that it's got so many different aspects to it, but the mainstream health system doesn't fully understand it. And there's an opportunity there to elevate the profession so that it's rewarded, remunerated, and provided excellence in healthcare, because it does already, just not being recognised for it. So to get that National Day of Recognition and to elevate the profession and provide all our staff and NAATSIHWP members that you do good work and you're worth it. And it's a day of recognition, but they also got the community members who probably appreciated it. And you know that just a bit more.
Yeah.
So we have a lot of the allied health days, like speech dietitian days and all that sort of stuff. That commitment from particular, because I work in the current government system, is to partner or elevate the profession to the understanding of your senior executives so that they can let the rest of the district know, or the rest of the department know, that the Aboriginal health practitioner and health worker has a role, and this is the role, and that, you know, it's just a simple luncheon or something like that, and showcase how it works within the system and the roles, and highlight those roles where we've got a multidisciplinary team, and an Aboriginal health worker practitioner provides that conduit component that the other health professionals and medical professionals, nursing professionals can't do. So they're an integral part of that, and that needs to be highlighted within the recognition when those executives get to tell them the National Recognition Day.